Hi, everybody. My name is Dr. Paul Gelston, and I'm a clinical psychologist based at Dubai Community Health Centre. So we are a team of psychiatrists, psychologists, speech and language therapists, and occupational therapists, and we support people of all ages with a range of presentations. In my work, primarily, I would assess and diagnose developmental difficulties in children and teenagers. So things like autism, ADHD, dyslexia, learning difficulties. But I also support children, teens, and adults with mental health conditions as well. So today I'm going to talk to you about autism spectrum disorders, or ASD, as it's more commonly known. And hopefully we can, I suppose, cover some of the areas related to ASD and hopefully shed some light on the condition and how it presents and how it can be supported. And then we will have a question and answer section at the end of the session. So the plan for today is just to think with you guys about what is autism spectrum disorder, or what is ASD, some of the signs and symptoms that are there, how it can be assessed and diagnosed, and how that varies across the globe, really. How children with ASD can be supported, and how schools and educators can take an important role in that support and that intervention moving forward. So in terms of what is autism spectrum disorder? So generally, this is a lifelong condition that affects how a person perceives and interacts with others. So people with ASD have specific difficulties in the areas of social interaction and communication. So social interaction is all about how we converse, chat, play with, and I guess just interact socially with other people. Communication, on the other hand, is obviously our verbal and non-verbal skills. So how can we express ourselves verbally? How can we start conversations? How do we use things like eye contact, facial expressions, body language? So other important features of ASD include restricted and repetitive patterns of behavior. So this can include any sort of repetitiveness in relation to speech, language that might be used. Some people with ASD have repetitive interests, and they really love to talk about the same interests a lot. Some show repetitive motor movements, so they might flap their hands, or they might hold their hands close to their face for visual stimulation. So generally speaking, people with ASD have these difficulties in these specific areas. So they'll have social difficulties in terms of interaction and communication, and they'll have the repetitive patterns of behavior or interest. So as I said, it's a lifelong condition or developmental disorder, which means that it's evident very early in life, and it does affect the person's development throughout their lives, and it stays with them throughout their lives. So unfortunately, there is no cure for autism, and it's something that always stays with the individual. Of course, the word spectrum in this is the key thing, because people with ASD can differ in terms of how their symptoms present, and it is seen as a spectrum because so many people can have different experiences or symptoms under the umbrella of ASD. So you might have people who function very well and who can go to school independently and have a career, and you might have other people with ASD who really struggle and need support day to day, with language, with everyday living, with interaction, with money-making decisions. So really it varies a lot from person to person. So in terms of the specific signs and symptoms of ASD in a bit more detail, usually it falls into these two categories overall. So the people, in order to get a diagnosis, they must have difficulties in these different areas. So for example, with social communication and interaction, you might notice that the child, or the adult as well, has maybe limited interest in beginning conversations or interactions with other people. They might show reduced response when other people try to interact with them. They might not reply if you call their name. They might not really play for long if you try to interact and play with them. Or they might struggle to share like what interests them. Like they might be less likely to carry a toy over to you and show you what they're interested in. And of course, there's difficulties with using body language. So you might notice the child doesn't use eye contact much. They might show very limited facial expressions. There might be limited use of gestures. And that's really when we use our body or our hands to kind of facilitate our language and our communication. And as well as this, some people with ASD really struggle to understand nonverbal communication in other people. So they might not understand what like a flick of the face means or frowning of the eyebrows, for example. And so it's not just about whether or not the child has poor eye contact or has good eye contact, because I think a lot of people focus on that. But really, it's a combination of these symptoms together that highlight some of the issues that are there. Some people with ASD really struggle to develop friendships or to keep friends, and they might not be interested whatsoever in their peers, and they might struggle to engage in creative or imaginative play. So that's whenever a child uses a toy beyond its intended purpose. So they might have, a pen, for example, and pretend it's a walking stick for one of their dolls. Or they might have a completely random item, like a little wooden block, and pretend it's a car, for example. So that's imaginative play. And then the second main area of symptoms for ASD is, like I said, the repetitiveness. So repetitive behaviors or interests. So some people rock back and forth. Some people show like repetitive motor movements in terms of how they use their hands, or what they might do with their hands or arms or fingers. Some engage in repetitive speech. They might repeat what other people say. I've noticed some children before who repeat comments that the teacher makes, even in the home setting. Or they might script, a TV show that they've heard or their favorite film. And some children use very formal language, so they sound a bit like a professor, even though they might be 6 or 7 years old. And then other things within this area of symptoms include things like struggling with changes in routine that are unexpected. They might have difficulties understanding things like sarcasm or metaphors or non-literal speech. Some children have very specific interests in certain areas. So I've worked with children before who are very young and know all the flags of the world. Or some have very repetitive interests and always want to talk about the same thing without understanding how other people react to that. Another, I suppose, main symptom within this category is overreaction or underreaction to certain sensory experiences. So some children with ASD react very negatively to normal sounds or light or touch, for example, or some might not react whatsoever to something that's actually painful to the rest of us. So as you can see, there's quite a lot of symptoms that fall under the umbrella of ASD. But generally, it's categorized in these two main areas of social skills and restricted or repetitiveness. So hopefully that makes a bit of sense to people. So just some quick facts about autism, and this is from the National Autism Association. So boys are 4 times more likely than girls to have autism. So for every 1 girl that's diagnosed, there's 4 boys diagnosed with autism. And really that's for different reasons. I think there's an underdiagnosis of autism in girls to begin with. But secondly, there are studies kind of highlighting the role of testosterone and how that may be associated with some signs or symptoms of autism. But there's no clear answer for that, really. Obviously, we know that the rate of autism and the number of people being diagnosed with autism is increasing over time. And it was previously a much less heard of disorder, whereas now it affects 1 in 59 children. And of course, children with autism do progress and they can have a bright future, but really early intervention is essential. And the sooner you can intervene and try to support a child, the better it is for them. So I just wanted to show you guys a video just to kind of summarize what autism is and what the symptoms look like and how it can present. And this is from the National Autistic Society, which is in the UK. So it's a great charity supporting individuals with autism. And they have made this lovely video. It's only a few minutes long, just to kind of summarize what the symptoms are. So I just wanted to play this for you just so that you can kind of get a succinct description of what I've talked about so far.
Do you know somebody with autism? Autism is much, much more common than most people think. About 1 in 100 people have autism. That's more than 700,000 in the UK alone. So chances are that someone you know or work with or love has the condition. What is autism? Autism is a lifelong developmental disability that affects how we communicate with and relate to others. And it affects how we make sense of the world around us. Lots of things that people take for granted, like body language and metaphors, can be confusing and alienating for us. Autism is a spectrum condition, so that whilst we all share certain difficulties, our autism will affect us in different ways. Some of us have been to university and hold down jobs, whilst others need a lifetime of specialist support. Asperger's syndrome is a form of autism. People with Asperger's syndrome are often of average or above average intelligence. They have fewer problems with speech, but may still have difficulties with understanding and processing language. What is autism like? For us, the world can be a confusing mass of people, events, and places. Sometimes we struggle to make sense of the world, and this can make us anxious. Every person with autism is different. That's what makes it so difficult to understand. But some of the characteristics that we have include a love of routines, sensory issues such as noises or smells or light, and having special interests. Some of us experience difficulties in understanding and relating to other people, and having a social life can be that much harder for us. For some of us, for example, going to a party can be really hard because we don't know what's going to happen or who will be there, and it often gets too noisy, which can be upsetting. Other people with autism have trouble reading facial expression, understanding jokes or sarcasm, or common phrases like break a leg. Even phrases people use every day like it's cool can be disorientating. You think they're asking you to turn the air conditioning off. Many people with autism don't look disabled. Parents of children with autism often say that people simply think their child is naughty, while we adults find that we are misunderstood. That is why it is called a hidden disability. What causes autism? The exact cause of autism is still being investigated, but research suggests that a combination of factors, genetic and environmental, may account for changes in brain development. Autism is not caused by a person's upbringing or their social circumstances. Is there a cure? There is no cure for autism, but there are interventions that enable learning and development which may be helpful. You can find out more by going to www.autism.org.uk/approaches. Diagnosis. If you or someone you know thinks they have autism, they can contact their GP, who can refer them to a specialist for diagnosis. So how can you help? There are many good people doing good work for autism up and down the country, but we need the support of the wider community. Together we can break down barriers. Together we can ensure that autism, which is far more common than other conditions that get far more attention, remains on the agenda. We hope that you will join us in helping more people with autism lead the life they choose. If you want to learn more about autism, go to www.autism.org.uk or click here. You can receive continuous news and information about autism by becoming a member of the National Autistic Society. As a member, you will receive your autism magazine.
So yeah, I thought that was just a nice video to kind of summarize what autism is and how the symptoms present, really. Obviously, that's from a UK charity and we're in the Middle East, and there are some differences in how autism is understood and what services are available for people with autism in this part of the world. So like everywhere, you know, awareness about autism is improving over time, and things are gradually getting a little bit better. Unfortunately, there's no official statistics for the number of people with autism in the UAE, but most centres that support people with ASD are at full capacity or do have huge waiting lists. So obviously, The rate currently is about 1 in 59 children have ASD of some degree, whereas previously it was 1 in 1,500, really as little as 30 years ago. So things are getting better, and there are recent headlines to kind of study and try to track levels of autism in the country and in the Middle East, but also about how it can be treated as well. And I think the government here is really working hard to try to increase people's awareness. So, for example, the Dubai Autism Centre was funded by the government here. Autism Rocks Arena, although it's an entertainment venue, even the name like that really kind of highlights the word autism to people, and it includes it in everyday terminology, which I think is helpful steps in the right direction. So in terms of assessment and diagnosis, ASD can be diagnosed by different professionals like psychiatrists and psychologists, pediatricians, or speech and language therapists. But the key thing to remember is that there's not one single test that diagnoses autism. So there's no blood test, there's no individual brain scan, there's no single questionnaire that works. And really, appropriate assessment of ASD has to be multidisciplinary and multi-setting. So what that means is that there must be a number of disciplines involved in the assessment of children with ASD. So it should always include different professionals working together during the assessment process. So that can include a psychologist, a speech therapist, an occupational therapist, as well as maybe a psychiatrist or an ABA therapist. And in terms of multi-setting, what that means is the assessment process should always look at the child in different environments or in different settings. So, of course, you'll see the child within the clinic. You should always see the child in school in some form or another. So a lot of ASD assessments will include observations of the child in the classroom or in the nursery school, just to see how they interact and how they engage with their peers. And really, there should be information from the home environment via questionnaires and even just in the community as well. And obviously, a lot of people who come for assessments of ASD have what's called a psychoeducational assessment. So these are like comprehensive assessment of the child's functioning in different areas. So we don't want to just bring a child in and say, right, let's do the autism test, because you need a bigger picture than that. So a psychoeducational assessment will always look at the child's skills in different areas. So you'll be checking their IQ, maybe their academics, and obviously their emotional and behavioural functioning, as well as their social skills. And a psychoeducational assessment identifies the child's strengths and difficulties and where their symptoms are, and it highlights a diagnosis if it's needed. So it gives all the information about the child's skills in these different areas, and how they compare to other children of the same age group. And it provides a number of recommendations for how the child can be supported moving forward after the assessment process itself. So any assessment of ASD should always include these various components at a minimum, really. So initially, the process should begin with an interview with parents to get a developmental history of the child. So this should include things like, what are the current concerns? When did the concerns begin? What's the perspective of other people? And how was the child's development in their early months and years? When did they start to walk and talk? How did they do at nursery school? How are things going so far in school? And following that, you would have then the process of individual testing with the child. So this would look at their, like I said, their IQ, academics, maybe their memory and attention, and their behavioural functioning, including their social skills. So for some children, this can take between 4 and 6 hours. And really this varies from child to child. There should always be information from the school setting, whether that's a phone call or a chat with the teacher, a report from school. I've had various teachers emailing me with their perspectives on different children. And really an ASD assessment should include a school observation of the child in the school setting. And that's usually best set up right at the beginning of the process, before the child is familiar with the person who's assessing them. Or you can send another member of the multidisciplinary team to the school to do the observation. And then, of course, a report is produced, and that includes all the information from the assessment process and whether that child meets the criteria for a diagnosis. And then there's always consultation with school staff afterwards to outline how they can implement the various findings and recommendations that are made in your report about the child's needs. And really, the report is useful regardless of whether or not the child has a diagnosis, because it will always give lots of information about their skills, as well as how they can be supported moving forward. So I added this visual just to show you that the importance really of the multidisciplinary involvement within an ASD assessment. So of course, the child's in the center of this image because it's all about them. And these are the various professionals, including parents, who can be involved in the assessment and diagnosis of ASD. And really the key thing that the evidence has shown us, and the key healthcare recommendations, are that there should be a team involved in the process. There should never just be one person diagnosing autism. And there should always be, a multitude of perspectives involved and considered within the process. And of course, across the different settings that the child functions in. So in the clinic, in school, and in the home and community settings. And all the information is brought together to make that decision. So in terms of supporting children with ASD, obviously there's a number of different options, and a lot of these can be quite confusing and scary for parents. And really, of course, all of this starts with the diagnosis, and that will depend then exactly what needs to come next for the individual child. So, of course, parents need education and training about autism, what the symptoms are, how that can present. And really, from my point of view, the parents are the expert about the child. They're the ones who know the children so well. They know exactly how the child operates, what the symptoms are, what works for them, what doesn't work. But I think most parents who receive an ASD diagnosis for their child will appreciate training or education to some degree. And with any assessment of ASD, we would always include lots of resources for parents after they've received the diagnosis. And of course, there's always liaison after the diagnostic process as well. But some children will need social skills training. Some will need ABA, which is a more behavioural intervention to target some of their skills. And obviously a lot of children need speech therapy or occupational therapy to target their communication or their motor skills. I've just noticed somebody in the audience has their hand up, but I think if they want to make a comment in the chat, then it's probably easier to respond to that, or we can answer that at the end. But really the consensus from any research about ASD is the importance of early intervention and how that really has to be prioritised. So the earlier we can intervene with children with an ASD diagnosis, the greater their outcomes are likely to be. So I just want to talk you through some examples of the interventions that are there. So a lot of children who receive an ASD diagnosis will attend social skills training, and these are specific sessions that aim to target their social skills. So it can be their verbal and non-verbal communication, so their eye contact, facial expressions, body language, their conversation and interaction skills, how they develop friendships, and how they engage with others. And these are provided in a number of different formats. So I work with teenagers with an ASD diagnosis who come for individual sessions to work on these skills. Some children work really well in small groups, especially younger children, and they would attend the groups with other children who have similar symptoms, and therefore they're working together with a small group of people who have similar difficulties and need similar supports. So the sessions would then target the children as a group. And of course, these sessions are available in school or in clinics, and they can be done in groups or as individuals. So I just noticed a comment about some of the symptoms. So of course, we can review those right at the end of the session, if that's okay. So these are just some of the examples of programs that are available to target children with ASD and their social skills specifically. So these are brilliant ones that can be implemented in schools, in clinics. Some parents can purchase these and just read through them to see what some of the strategies involve. But these are really common ones that target social skills for children with ASD, and I would definitely recommend them to parents if they're interested. And I include some of these in my assessment reports. And some children will come and attend the clinic with me, and we'll go through some of these programs together. Some children need very specific intervention and supports depending on what their needs are. So a lot of children with autism struggle with transitions, which is their ability to move from one task or activity to another. And really they might need things like a visual timer, or maybe a visual calendar or schedule. An activity during the transition, like a tidy up song, works really well for some children. Or even just asking other children to support the child during the transitional period is quite useful. A lot of children, I think generally, but also children with ASD, need a lot of help understanding emotions, what different emotions are, how they're expressed in them as an individual, but also how other people express them. And there's various different ways you can do this with kids, but emotion charades is a great example of how that can be explored. So these are just some of the examples of emotion charades that can be used with children. So you would pick certain emotions and ask the child to show how that would look in their face, or how they might feel in their body, or how somebody else might react, or what you might say to somebody who's sad or who's excited or who's angry. And of course, it can be played in different ways. So you might specifically give the child the emotions that you want them to show, or you might give them a scenario like this page on the left, and the child has to imagine like how they would feel in terms of emotions based on each individual circumstance. Other supports for children with ASD can include specific things that target their social skills. So whether this can be like a buddy system at school, where the child is paired with someone else in their class, or someone else in a different class who can kind of, I suppose the process encourages development of friendships and relationships with peers. Really, I would say to most parents of a child with ASD, encouraging them to engage in activities with other children as much as possible outside school is really good as well. And it doesn't have to be a social activity as such, but even something that's sport related or that links to their interests is a great way for them to meet other children and develop their social skills, even informally. And I would always encourage teachers and teaching assistants or shadow teachers to work hard within the school setting to encourage children with ASD to engage a little bit more if they can. So like all kids, you know, we all need time by ourselves, and children with ASD are no different, and that should be encouraged at times. But if it's noticed that it happens a lot or happens most of the day, then it's good if teachers and TAs just kind of encourage children with ASD to socialize a little bit more. So these are kind of more, I suppose, environmental strategies that can work well with children with ASD. So social stories is a very common intervention for children with developmental difficulties or children who struggle socially. And they're great for children with ASD as well. So social stories are, I guess, how to describe them is that they're step-by-step instructions or information about a specific event or an activity that relates to the child and that the child is usually struggling with. So this can include very simple things like emotions, the morning routine, and how to behave in a circumstance like in the mall or in school. They can include like descriptions of certain relationships, and really like they can be applied to any type of setting or any difficulty that the child is having. And social stories are available as like little worksheets. They're available in book format. They're in short video clips. And the key thing is they can be built right from the beginning to suit the individual child. So I have developed social stories with children before, depending on what their behavior is and if they display maybe inappropriate behaviors out in the community, or specific social stories that target repetitive behaviors that maybe the parents don't want to see so much, just to try to target those. So there are specific social stories that exist already and can be applied to many children, but there is an option to kind of build it based on the individual child as well. So I just wanted to show you this short video. It's just over a minute long to kind of explain frustration in a social story. So this is for children, maybe with ASD or other difficulties, who struggle to manage frustration. And the aim of the social story is to try to encourage them to recognize it first of all, but also to maybe behave differently when they are frustrated. So I'll just play the video for you.
Frustration, a social story. Sometimes I feel frustrated. When I am frustrated, I can ask my teacher if I can take a break. Can I take a break? Yes. When I take a break, I can breathe, I can write about it, I can draw about it, or just rest. When I am frustrated, I can ask my teacher if I can take a walk. Can I take a walk? Yes. When I am frustrated, I can ask my teacher if I can get a drink of water. Can I get a drink of water? Yes. When I am frustrated, I can take 5 deep breaths. I feel better now. Frustration, a social story.
So of course, that's a very simple, basic video, but you'll notice that it gives specific instructions to the child about what to do when they feel frustrated, and it visually demonstrates how they can do that. So it's quite a nice example of a social story that explains something that is quite, a basic emotion, but that a lot of children really struggle with. And like I said, the social stories can really be applied to any aspect of the child's life. So there's something that's used quite widely with children with ASD, and something that works really well if children are struggling in certain areas. So of course, these are just other examples of visuals that kind of support children with ASD. So these ones specifically target tone of voice and volume of voice, so that children can see what's appropriate and what's not. So here you'll see there's a game about guessing the tone of voice. So people are bored, happy, tired, or scared. The thermometer here is quite a useful one, which visually demonstrates to children what the appropriate volume is for their voice, depending on the environment that they're in. So for example, some children with ASD talk extremely loudly, or some talk very quietly. And this is a visual to try to demonstrate what their adequate volume should be. And this would be practiced with the therapist, so that the child can, really understand and see what it is that's more appropriate for them. So just a note really before we finish on other diagnoses. So the DSM-5, which is this book here in the top right, is like the official medical guidance for how different disorders should be diagnosed. So they outline the various criteria for different disorders in a range of areas of medicine and healthcare. And really, I suppose under the umbrella of autism, people may have heard of Asperger's syndrome or social communication disorder. And I just wanted to make a note on those, as part of today's presentation. But basically, Asperger's syndrome is no longer an official diagnosis. And this was removed from the most recent update of the DSM-5, which is, the official guidance for how to diagnose these conditions. So if people present with symptoms of Asperger's syndrome, they would now receive a diagnosis of autism spectrum disorder, and they would fall within that category. But in the past, this referred to people who did have ASD symptoms. So they did have the social difficulties, they might have had restricted or repetitive behaviours, but they generally didn't have any weaknesses in their IQ, and usually they had strengths in their IQ and strengths in their verbal skills. And of course, some people who were diagnosed with Asperger's are welcome, to continue using that term if that's what they prefer. But generally speaking, it would not be diagnosed as a new condition anymore in terms of new assessments and new diagnoses. Social communication disorder, on the other hand, is a new addition to the DSM, and this refers to social difficulties really with verbal and non-verbal communication. So people with social communication disorder might struggle to communicate socially. They might have difficulties adjusting their communication to suit different contexts. So for example, how you would interact with, another 10-year-old if you're 10 compared to how you might interact with an older adult. They might struggle to follow conversation rules or understand non-literal aspects of communication, like metaphors, idioms, sarcasm, things like that. And generally, people with social communication disorder don't present with restricted or repetitive behaviours or interests. So the research has shown that there is a subset of people who fall under, I suppose, the realm of autism-related symptoms, but they don't quite have all the symptoms. And so this new disorder was developed to kind of account for those symptoms. And then just the role of schools and educators, of course, we would work closely as a clinic with different schools across Dubai and the UAE. And this really is something that applies to children with ADHD, but it also links very closely to children with ASD. And really schools have a responsibility to adjust these various aspects of the child's school environment to support their needs. Depending on what they are for that individual. So of course, teachers should be identifying children who present with symptoms, encouraging parents to come for assessments and diagnosis, and they should use our reports that we have provided, including the various accommodations that are recommended, and they should be building IEPs or individual education plans for children, and these map out exactly what their difficulties are and how they can be supported. And then things should be reviewed regularly. So it's not just about the families coming to clinics and that's the relationship. There is a huge role for schools as well. So these are just some extra resources if parents want to get more information. So Autism Speaks is a great website. I think it's an American one, but there's loads of information about autism and the symptoms and the supports that are available. The National Autistic Society is one in the UK, and of course there's various resources online and in book format. So if anyone has any queries about these, or if they want pointed to a certain resource, just feel free to get in touch with me as well. And these are my contact details. Check out my Instagram, give me a follow if you're on there. I have lots of different posts and resources regularly about a range of mental health conditions. And people are welcome to message me there if they have any queries. And these are the contact details and website to our clinic if people do want to get more information or contact us. And of course, like I said, we're a multidisciplinary team. Some of us, are fluent in Arabic, Urdu, Hindi, English, and we've male and female staff. People prefer different genders. So feel free to get in touch with us if you need us. And thanks for having me.
We have some questions. So there's a question, how can I find out what caused the autism and if the cause was genetic or not? Is it possible?
I mean, it's a common question that a lot of parents will ask, but it's very difficult to pinpoint exactly what causes autism. And this was kind of highlighted in the video, really. There's no exact consensus on what causes autism and what may contribute to autism. There's no real specific gene that's been identified, but we know that in some families, rates of autism are more likely to be higher if someone in the family has a diagnosis of autism. But it's very difficult to pinpoint exactly what has caused this in different children. And generally it's seen as a combination of factors, really. So it's difficult to answer that question with certainty, and I wouldn't want to do that with any clarity because there's no real agreement or consensus, in the medical world.
Thank you. There's another question. How early can ASD be diagnosed? And does ASD affect motor skills?
Mm-hmm.
And then the third question is, who's the first person, doctor, specialist, parents should go to for diagnosis?
So in terms of like a specialist who you can see, so really this will depend on what the family do normally. So some families will contact us directly as a clinic and say, I want to have my child assessed for autism, and they're welcome to do that. Some will visit their pediatrician first, kind of for a screening to see if that's needed. Some will come to us at the clinic, and we would always start with that screening process initially to see what's required. Or some will go to their GP as well. So really it varies, but I think in the Middle East and in Dubai, because of the private healthcare system here, most people will directly go to a clinic that specializes in autism assessment and diagnosis. And I think that's probably the fastest way to kind of start the process. Yes, autism does affect people's motor skills, but not for everyone. So this can vary from person to person. And some children with autism do require support to develop their motor skills. So things like maybe their pencil grip, their handwriting, and their ability to run and jump. But it's not part of the diagnostic criteria. So it's not always evident in all children, but it does happen for many. And in terms of the age at which it can be diagnosed, generally it's around the age of 3 years old, and this can vary from child to child, but there are screening measures that can be used before that. And there's lots of research and literature to try to highlight why we can't diagnose autism earlier than this and why we can't notice some of the symptoms before. But generally speaking, children's development does vary and fluctuate, especially in their early years. And that's why it's kind of seen as something that is more likely to happen at the age of 3 or 4 years old.
Thank you so much. There's one more question. What's the difference between the speech delay and ASD? And are the red flags for ASD for different age different? For example, the red flags for 2-year-old and 4-year-old.
In terms of the difference between speech delay and ASD, generally a child with speech delay can play and interact with other people, but they may not be using their language fully appropriate to their age, or they might struggle to understand what people are saying, or they struggle to communicate what they want to say. Somebody with ASD generally has limited or reduced interest in playing or interacting with others, and they might show reduced response when others attempt to interact with them and demonstrate their repetitive or restricted behaviours or interests. So speech delay is communication only, whereas ASD is more about social interaction and social skills, as well as some repetitive behaviours or interests. And that's the main difference, really. In terms of like red flags for different age groups, especially as young as 2 years old, it is quite difficult to get agreement on that. But generally speaking, for very young children, if you're noticing things like they don't respond when you call their name, they might not respond when you smile at them or coo at them, or they might not engage in some of the play routines that you're getting involved in, or they might not sing along or dance along or do the different play activities that you're doing. Those are some of the signs, really. But yes, the symptoms do fluctuate depending on different age groups. And generally, the red flags between a 2-year-old and a 5-year-old are probably not that hugely different, but generally the social difficulties are evident if you look closely.
Thank you, Doctor. I think that's it for the questions today.
I think there was a couple of questions just at the beginning about somebody missed the symptoms for the syndrome, but really these are the main signs and symptoms of ASD. So generally there's two main areas. So the social skills in terms of communication and interaction, and also the demonstration of restricted or repetitive behaviours and interests. So things like less interest in socializing and interacting, less response when others try to interact, maybe difficulties using or understanding non-verbal communication, difficulties developing friendships, repetitive motor movements or speech is quite common, difficulties adjusting to changes in routine, maybe fixated interests in very specific topics that might seem unusual for the child's age group. And sometimes children with ASD show overreaction to sensory input or very limited reaction to certain sensory input. And these are the main areas of symptoms that are most prevalent.
Thank you, doctor. Thank you so much.
No worries at all. So again, have a follow for me on Instagram. People are welcome to email me if they have any questions about today's session, because I know some people prefer to do that privately as well. And obviously you can contact us at the clinic as well if people want more information.